Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is to those finding fun and safe ways to celebrate Halloween this weekend. Seeing dozens of happy dressed up children come to your door begging for candy can be a highlight for many folks. However, this close contact can increase the risk of exposure to COVID-19. The good news is there are several options to reduce your risk and the risk for the children while still getting to engage with the trick-or-treaters. One idea is to put a table at the end of your driveway with bags of candy for children to pick up. You can sit away from the table and let the children come up and grab those bags of candy as they go by, encouraging them to group as families and not group up together as a big blob like they sometimes do. Another one is creating a candy chute. This sounds fun to me. You can do it using PVC pipes or any other type of household thing that you could slide some candy down through, so the kids can get it from there, and you're able to stay 6 feet away from them. And kids might actually enjoy it more because it almost turns it into a game. Also, try to make sure the kids and families gather within 6 feet of each other to reduce risk. I kind of said that earlier. And wear masks if 6 feet can't be maintained. And remember, a Halloween mask is not a substitute for a cloth face covering. So mom and dad, be creative with those masks and get your kids some fun Halloween mask to wear for their trick-or-treating. Excuse me. I'm sorry. Excuse me. These are just a few ways to celebrate the Halloween season while ensuring you and those around you stay safe. We are holding another public flu vaccination clinic today at Hall Senior Center on Crippen Road from 3 to 6. We'll have both flu mist and flu shots available. However, we will not have high-dose flu vaccine at this clinic. Vaccine will be given to children 6 months and up, as well as older children, excuse me, and adults. If you haven't received your flu shot yet, make plans to attend today's clinic and get it taken care of. Everybody needs to make sure they get a flu shot this year. Now we'll move on to the local situation. We have 103 new confirmed cases since yesterday's report, giving us 12,723 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 616 probable cases. 11,713 of our cases are considered inactive, giving us 1,525 active cases. 456 individuals have been hospitalized at some point in their illness. Currently, we have 67 Knox County residents hospitalized. Fortunately, we have no additional deaths today, keeping our total at 101. I do want to take a moment to express our sympathy for the families and loved ones who've lost someone to COVID-19. Every day, the work we do in this building is to try and prevent our other families from experiencing that same level of pain and grief. I ask you to please continue to practice the 5 core actions in the interest of protecting yourselves and our community, and in every situation to reduce our hospitalizations and our deaths. Our community is losing, we don't want our community to lose any more people to COVID-19. So everybody needs to do their part to reduce the risk. And now I'll open it up for questions.
All right, everyone can submit questions into that chat feature. First question we have is from Scott Barker with Compass. How has the anger among some over mandates affected staff?
So that's a great question. In this situation, the mandates are coming from the Board of Health. We are trying to help people understand how to comply with the mandates. And so there's a lot of crossover and confusion about who's doing what, who's making what happen. And so we're kind of guilty by association. The Board of Health is our board, and some of that anger gets misplaced and directed toward our staff. I understand people being frustrated and angry, but it's really challenging. It's challenging for contact tracers and case investigators because we're finding less cooperation, and part of that is just due to fatigue, and part of that is due to the overall negativity that seems to be very pervasive among some people. In addition to that, our phone bank takes calls from people who are upset about things, and angry. People are very unkind. And it's really challenging for staff to come in every day. We have staff also who are paying attention to traditional media and social media. And as we all know, people feel very brave on social media to say whatever they want to say, and they're doing so. And it's hard for our staff to hear those things about public health and not take it in. And so we're working actively as leadership here at the health department to come up with creative ways to support all of our team as we all come in every day to do the job that we're dedicated to and that we know is the right thing to do in protecting our community. So we're working really hard to how do we better support our staff to just make it and keep coming in every day, encouraging people to take time off and really step away. So thanks for asking that question. It's a challenging time for all of us.
From Daniel with WBIR, Knox County Commissioners have now voted in favor of a new Public Health Advisory Committee. What are your thoughts on that possible shift in public health responsibilities?
I think there's a lot to learn about how this committee will operate and what it'll look like. As you heard Mr. Vandevate say last evening, vetting those positions will take some time, so it'll take some time to stand that committee up. And we'll just have to see how the commission and the mayor want to use that committee and how they'll interact with our team here or the Board of Health. There are a lot of unknowns, but we'll work with whomever is on that committee to advise and make good decisions for the community.
From Megan with WVLT, how could the case count be affected if everyone in Knox County wore a mask? And can you speak about the data that supports mask wearing? Well,
sure. There's plenty of data to support mask wearing. You can actually look at places where they have mask mandates and where they don't have mask mandates and how the case numbers and case counts lower or flatten out when the mask mandates go into place. There's lots of evidence published in the Lancet and other reliable journals that talks about the effectiveness of masks, the difference between mask and social distancing, and that both of them work really well, and in combination they work really well. So there's lots of data out there. There was another part to that question, and I forgot it.
How would the case not be affected if everyone in Knox County wore a mask?
So it's hard to say how it would be affected if everybody wore a mask, but it would be lower. I think our climb would be less steep than it has been. So our trajectory would be different. We'd be more on the flattening the curve side. There's some published data that I can't quote right now that talks about if everybody wears a mask, if you have 100% compliance or 100% of the people who can wear a mask, understandably, there are some people who can't wear a mask, then you really reduce your cases because we're just not spreading it unknowingly. There's nobody out there who's, conniving to give other people COVID-19, but people are unknowingly giving people COVID-19 because maybe they're not very sick or they don't have any symptoms yet and they're not wearing a mask and they're talking to their friends or having lunch with their friends and giving COVID-19 to people inadvertently. So we really want to avoid that. So again, practicing 5 core actions is really important for everybody, and it would help lower our counts and reduce our case rate.
From Vincent with the Sentinel, on the agenda for tomorrow, the Board of Health has 2 items, the finalization of new metrics and a discussion of additional restrictions. The KCHD chief epidemiologist has been working on those metrics. Can you elaborate on what those metrics are intended to do and what are they measuring?
So we talked about those metrics 2 weeks ago in the Board of Health meeting, and so they're part of the public record that was sent out, so you can look at those. So those metrics are intended to help guide the Board of Health and also inform the community, just like the metrics that we use here, our benchmarks, about how well we're doing as a community in reducing COVID-19. So we're looking at such things as hospitalizations, positivity rates, and other things. So using those to guide the community and to guide the Board of Health in deciding to remove a restriction, or do we need to do something else, like add something to the restrictions? And those will be decisions the Board of Health will make. Those are tough discussions, as you can imagine. Deciding to put more things in place is really challenging. And we understand the impact on our community when we do that. We're still working on those. We want to make sure that we have good and reasonable metrics in place. We've looked at lots of different resources, some publications from the Harvard School of Public Health and other places to help us see where those metrics should sit in a reasonable place to allow us have some guidance for when we can lift or need to add restrictions.
A follow-up to his question, Vincent asks, who at UT have you been working with specifically?
I actually don't know, but I'm getting an answer. We're working with their data analyst, Keith Britt, and our epidemiologists are working with Mr. Britt, or maybe Dr. Britt, on that. He's a great resource and a good partner for us.
From Daniel with WBIR, can you help us understand the difference between the efficacy of antigen versus PCR tests?
The efficacy. Okay, so antigen tests are really not very reliable. They have a wide margin of reliability. The PCR test is the most reliable test we have for diagnosing COVID-19. It's a very sensitive and specific test for COVID-19, meaning if it's positive, you have the disease. If it's negative, you probably don't have the disease, although there sometimes are more false negatives than there are false positives. The other challenge with using antigen testing is that who to use it in, and using it inappropriately really gives you inaccurate information. So we really discourage the use of antigen testing for diagnosis at all.
From Jeff with WATE, the hospital system sent out a message today noting the spike in cases we discussed last week. Of course, they're the ones to speak to their statement, but can you discuss KCHD's communications with the health system since our last briefing?
We talk with the hospitals every day. We're part of their, not me, but one of our team members is part of their daily call to talk about capacity and beds and all that kind of stuff. So we're very involved and very engaged, and advising and listening to what they're doing, and part of those discussions every day.
Jeff's follow-up question is, what happens if we do see another hospitalization surge, and can we still use the expo center?
So what happens if we see another hospital surge really is up to the hospitals. They'll make that decision. We'll be part of that discussion, but that's ultimately their decision to make, and how they know best how they can change their operations to accommodate more patients. So I think they're looking at lots of different options, and I don't think any one option has been chosen yet, but there are lots of different options. The question about the expo center is actually whether we can use the expo center is actually more of a state decision than a local decision. So I'm not sure about whether the expo center is still a possibility for an alternative care site. Our hope would be to not have to have an alternative care site.
From Vincent with the Sentinel, this question I believe is coming from one of his colleagues, Isabel. How many Knox County Health Department liaisons work directly with the schools?
I'm looking at Charity for an answer while she's thinking about that. And the reason we hope that we don't have to go to an alternative care site, and going back to the last question, is honestly about staffing. You can build the space, but if you don't have people to work there, it's not very useful. So do I have an answer for how many?
I'm going to get an answer to him.
We'll get you an answer.
I don't want to give you the wrong answer.
We know it's more than 2, but that's right now, that's all I can say for sure. We think it's 7, but don't quote us on that. We'll get you an answer for sure.
Another question from Vincent from Isabel with the Sentinel is, what percentage of people in the county that test positive for COVID-19 say they have been in contact with a known case?
This is Charity in the background. I need to look at it for this week. Last week, I believe it was around 35, 36%, but we'll get the data this week and get it updated to you.
Did you hear that?
Just in case you didn't hear that, we will get that data and get it over to you. As of last week, I believe when we spoke with Isabel, it was around that 35 to 36%, but we'll check it for this week and get back to you in addition to your previous question. From Jeff with WATE, are you concerned about the county commission creating a new health/economic committee that it might offer conflicting advice from what you might recommend?
I think having different points of view and different input into decisions being made is always useful. Medicine is an art, and there's certainly different points of view on how to handle different things. And public health certainly has different points of view as well. So I think, we do listen to our community. We've heard input from our community, and we will continue to do that. We've heard people say, tell us more about how to just be healthy and reduce, not necessarily reduce our risk of COVID, but reduce our risk of getting too sick from COVID. So we've thought about how we're going to do that. And we're committed to working with whoever is on that team to guide the mayor and the county commission and our community in making good decisions.
From Megan with WVLT, polling data shows that many Americans feel skepticism about a vaccine that may be released in the coming months. What would you say to those who say they are considering not taking a vaccine when it is released simply because of safety concerns?
Well, first of all, of course, everybody is entitled to their opinion about whether they take a vaccine or don't take a vaccine. But I think what we can be assured of in this country is that they will be following the same strict guidelines that are in place for approval for vaccinations regularly. And some of those vaccines, if you've heard people talking about, they start that process, and that's where things are probably going to slow down a little bit because the FDA takes their time. They want to be very sure it's a safe and effective vaccine. And I appreciate that, and everyone else should appreciate that. So I look forward to the FDA giving approval to a vaccine so that then we can start vaccinating folks and reducing risk. So I would encourage everybody to pay attention. And, if you're not comfortable taking a vaccine, that's certainly up to you. You could sure wait a while, see how it goes for the first few people that take it and decide to take it later.
From Daniel with WBIR, follow up to a previous question. You said you discourage antigen tests in general, calling them unreliable. Does that apply to a lesser, equal, or greater degree for use of antigen tests in nursing homes?
That's more surveillance, and then
yeah,
they follow up with
right. Antigen tests should, and I discourage them for the use of diagnosis, for the use in diagnosing COVID. Using antigen tests for surveillance is useful. So you do the antigen test on a population and then go back and confirm or not confirm that person's a case with a PCR. So that's the appropriate use of antigen test, but not for diagnosis.
From Vincent with the Sentinel, Commissioner Larson J. last night warned that the creation of this new health advisory board was a step towards dissolving the Board of Health. Are you concerned about that possibility?
There's been talk about dissolving the Board of Health. There's been talk about some legislation that might happen at the state level to change the authority of local public health. I am concerned. It's a big change. It's a big shift. But I'm also open to working within whatever system thing is created by our legislators and by those who are making those policy decisions. It'd be a big shift for us, but 2020 has been a year of big shifts, so we'll just keep having more of them.
From Claire with WUOT, have you seen any trends in cases connected to buses and public transportation and contact tracing?
We have not.
All right, any further questions, please go ahead and submit them into the chat feature now. All right, I'm not seeing any other questions come in, so thank you all for your time, and we will see you again on Thursday at 12:30. Have a good and safe rest of your day.